Now, a number of people have been arrested in Accra and Kumasi for flouting the 14-day movement restrictions. My colleague Erastus Asare-Donko joins us live from Kumasi with some update on this. Erastus, tell us about the compliance level in Kumasi since the restrictions started yesterday. Well, I think we're having difficulty reaching my colleague Erastus Asare-Donko. But Erastus, if you can hear me, I'm asking about the level of compliance. Restrictions started yesterday. What can you tell us about how people are complying with this directive?
Well, currently, if you can see the streets behind me, you can see it's all clear. This is the road that leads to Addo proper, and just to my left here is the Kumasi Metropolitan Assembly. Now this is a very busy street, but today you can find out that it's almost totally empty at the moment. So this is a reflection of what is happening across many of the streets you find in the length and breadth of Kumasi. But there are a few areas where people are not obeying these protocols that the authorities have set out. You can talk about Asafo, where all the cold stores are open at the moment, and so it's becoming increasingly difficult to prevent people from being attracted to the frozen foods that are being sold on the streets. And so just a short while ago, we had the task force made up of the military, the police, and the KMA city guards going over the streets, arresting people physically and putting them in vans as we speak. So we counted about 20 people who have been placed in vans waiting to be transported to the Central Police Headquarters to be handed over to the police. So in those sections of society, that is what is happening. People are not obeying the social distancing protocols. People are not leaving the streets. They are being attracted by the cold stores that are directly open at the moment. And so the task force is going around and asking people, if you are not doing anything in town, they arrest you, put you in that particular van, and send you to the Kumasi Central Police Headquarters.
Erastus, just for clarity, all 20 were picked up at the cold store, and what exactly is the offense? Not adhering to social distances, is that it?
Well, so I asked the same question to the leader of the team, and he was telling me that they've been given instructions that people who are gallivanting in town doing nothing are supposed to be arrested, kept in that vehicle and transported to the Central Police Headquarters. He is not able to tell me what charge will be given to them, but they believe that when they are handed over to the right authorities, they will prefer the right charges against them. And so their duty is just to arrest them, get them into that caged caravan to be sent over to the Central Police Headquarters.
Now, beyond the compliance, let's talk about the defiance. We know that people in the food value chain are exempt. Do we have people who are not within, who do not fall within this range, flouting the rules by opening their shops and operating?
Yes, just about 30 minutes ago, when we were following the task force, they had to ask the gentleman within the Asafo market to close down his shop because he felt he was not part of the group that the president has asked to open their shops. He was selling plastic polythene bags, and he was telling us that he sells them to some tomato sellers and garden egg sellers, vegetable sellers. That is what they use to bag their products when they sell them. But they were told, he was told that he is not part of the exemption list, so he was asked to close down, and he closed down immediately. Likely, we saw somebody within the Asafo market who was doing construction work. And so quite a number of people were in there working, and likewise they were told to stop working because they felt that they were not part of the exemption list. So yes, there are people who have opened shops and they are not part of the exemption list, and they are being asked to close the shops.
Erastus, just before you go, the police yesterday told us that this is supposed to be humanitarian, the exercise that is currently underway. What has been the feedback from the communities as far as the patrols are concerned?
Well, we have received some complaints, especially from one person I recall who had cane marks on his back, and he has posted those pictures on social media. And he was narrating how he was beaten in front of his mother's shop because he had not closed the shop to people, and they were selling in front of their house. And so I don't know what happened, but he said that he was beaten, as surely you can see the cane marks on his back. But then aside that, we have we have met the task force in the night. That was yesterday in the night, where we saw, in fact, they look quite menacing. You see them with whips and canes. And me, for instance, I was asked about my ID card. When I showed my ID card, they asked me whether if you're a media person, that doesn't give me the right to be moving around. That was the comment that came from them. And so I saw some people being beaten in that particular area. So yes, there's a certain level of force being applied by some of the teams, but largely they are also talking to people and giving them advice as to whether they can move around or they can't move around.
Erastus, thank you very much for bringing us up to speed on this 14-day restriction, day 2 from Kumasi, where we understand some arrests have already been made. 20 people arrested from Asafo. These people were all at a cold store trying to get some frozen foods. And of course, there have been some defiance as well from people who do not fall within the food value chain. But let's come here to Accra, where my colleague PSC and Asafo is at the High Street here in Accra Central, where dozens of women and children were intercepted on a truck this morning attempting to escape to the north. Before we speak to him, let's hear one of the arrested women pleading for the truck driver.
Okay. Sa obi a wo baby da won wo ho woni baby da won bobodi na won kohie na yaso ya ne baby a ya beda na so omo la kegeti na ya pitan kola ya ne esika ide kwa kwaso ebe ne mo ode ne kro mo nua ana driver we omo ya kocho atitu station gas ne nyina ko ana we wade bayere na baye ana ochom obose se adan na esi na omoto ya tutu sisi ya ne tutu ya ne ka bia de beko ana ya susa na se sa omo ba pena ama ne kwan de akwa nko de beko akosi yakuro na osamba wono wan fa wan kwa na fa na ka ne lodi nipa ode lodi bayere ana ode ya tinam nti yakwa akotro nkoko press fo wa ana omo chi ne ka tan se yansa na chi na wan fa yambra Accra ade na eba ne se tapole na wade kata ya hono anya ono na de kata na so amuna ana wade kata pole na kata ya hono to mu tapole na ana mu kacha na sati na wade ya to kan so ya fa lo de na pa
na mo Accra ifa na moko ifa na muti Accra
na ti tudu na ya free antina yako na wakati se adanti na motapole kata ya kana ode fa ya sense ono so ne se anya ba ahonche ne ti na ode fa ya no anya ya foto anya ono so for nti sa na e ba no nka sisi ya pa obi a che se omo bie kwan kakra ma ya na akwa asundue mo na mpesu ya no ana ne fo de si andi ti
na mo ye be ahe
ye doso
be ahe
ya love ya tena sisi ya driver na kura no ho akire wa sit ne patro no ensu na ma ode akoduro onu kwa na esu no ya bro no kwa nsu no wasuro se wasako.
And so the woman we had there is part of the people who are headed for the north in that truck. And as she explains, there are no buses actually to help them move to the north. And so this truck driver offered to help them because there are no buses. And she is from Tudu. Almost all of them, the majority of them are headquarters. They're also traders amongst them. She says that they've actually not eaten for 4 days. They are pleading to be exempt. They want to make their their way back home to the north, where many of them are coming from, because they do not have a place to sleep. They do not have shelter. And so that is what forced them. They went all the way to Nkoko, and that was when they were asked to return to Accra. The police instructed the truck driver to make a U-turn back to Accra. That's the woman there. Let's go to the phone lines now and speak to my colleague PSA. And now, so PSA, where are these arrested people, and what more can you tell us?
Indeed, Ernest, the first clarity we should get for our listeners and viewers out there is that these people here have not been arrested as of now. I'm looking at them right now. They are standing close in a closed cluster, close to the truck, and none of them is in handcuffs or anything. The authorities, which is the AMA, are also here. We understand they've been instructed by the mayor of Accra, Ni Ajay Sowa, to provide food for these ladies and their infants, that's their children, for the time being, and as and when they can, they'll start processing them. The police service has been here about an hour ago to check happenings. They haven't given us any official comments yet. They haven't moved forward to arrest any of them, but it seems to be quite a delicate matter on the side of the authorities. So as of now, they have not been arrested yet, but they are still at the same position. Most of them are standing in the sunlight. A few of them have withdrawn into the truck from which they were arrested, which has, of course, the trampoline above it to shelter them from the sunlight. And also, they are waiting authorities on how far, as and when, after they've received the food, they will proceed.
Yes, exactly where are they right now as we speak?
Yes, so they are here at the Accra High Street, a few meters from the Bank of Ghana facility. This place is known as the Beijing Power. That's the area in which they are. And the truck itself was parked into a corner of that area, that location that I've just described to you. So that's where they are, right in front of the truck. The authorities also of the AMA, you could see their 4x4 vehicles, at least two of them parked by them as they are trying to interact with them, get more of their details, and also provide for their welfare, starting with the food, which they are still waiting for at this time.
But do we have the police there?
The police, I'm not seeing any police officer here at this time, but an hour ago, they came with vehicles. They stood briefly and made a few observations, and then they left. It's unclear what the next plan of action will be. But for the meantime, as I said earlier, authorities are focusing on getting them some food, and they'll proceed from there.
So who exactly is holding these people? Who is in charge now as we speak?
Well, they were discovered at dawn as at 5:30 a.m. by the AMA patrol team in respect of the lockdown procedure that's currently happening in the country. Apparently, they were speaking to one of the residents in the area here. The driver was speaking to them, but according to the witness, that he had a few foods that he would like to put aside or something of the sort. It was then that one of the patrol officers discovered certain women were sneaking behind the cargo truck and called for reinforcement. Thus, the women were discovered in a particular manner.
Because you've been interacting with them, what have they been telling you? The soundbite we heard earlier, the woman said they've actually not eaten. You've indicated that there are plans to get them food, but what more have they been telling you?
Well, so far, so they tell me the main reason for them going back. These people had earlier, it's not like they were about to embark. They've already tried in part of Kumasi, and they were told to come back. According to their own witness account, and that's the reason why they arrived here. They say most of them that I've spoken to are headquarters at Tudu right here in Accra. They say as part of the self-isolation measures, they could not sleep on the streets since they do not have any homes. Many of them were returning back to Wale Wale and their homes in the north, where they have a family or two who can take care of them within this period when the whole nation is returning or going indoors.
I see children on our screens. Can we estimate how many of these people were in that truck?
Well, I counted at least 12 children. That's between the age bracket estimate of about 5 to 6. I count about 12 of them in that nature. But it's yet unclear because authorities have not confirmed the figures as of yet. But it was quite a small confined area. And for the women, that's the adult people, there were about 20 of them. And for the children, I counted about 12.
What is the indication you're picking up as far as their plea for exemption is concerned? They want to be given the opportunity to head back home.
Yes.
What is the indication you're picking up from the authorities?
Yes, that has been the main plea from almost all the reporters I've engaged with this morning. They all repeatedly they're asking that they be given the opportunity, if not the funds or the transport or whatever. They just want to go back to the north. Many of them have not been in Accra here for quite a long time. Many of them have only been here for about 2 months, about 3 months, and that's already, even before the corona outbreak, they have been homesick due to the conditions. Many of them have children without fathers that they need to go take care of, and so many other such reasons.
Peter, we know that they went all the way to Nkoko. When exactly did they return to Accra? What time do we know?
Yes, so they told me they left Nkoko around yesterday at 4:30 a.m. That's according to one of the witnesses that we spoke to, Nafisa Amidu. She says they left yesterday at around 4:30 a.m. and they arrived. I don't know how they were, whether they made any stops, but they arrived at dawn, which is questionable in itself. But then again, most of these women could not give us accurate details. Most of them could not even give us their ages as of now. So it shows you the gravity of the situation here on the ground.
Peter, thank you very much for bringing us updates on these traders who have been asked to return to Accra on their way to some part of the northern part of the country, Wale Wale, amongst other. Colleague Ifwa Evans-Chini reports of traffic at some checkpoints here in Accra. She joins us on the phone with details. Ifwa, where have you been and what have you observed?
Yeah, hi, Ernest. Heavy traffic, but a few people out there on the streets this morning. Interestingly, Ernest, everybody or everyone has an excuse or a reason why they're out here on the streets. Before I delve much more into that, let me talk about the traffic at the various checkpoints and how tough security personnel have been on individuals. They don't only ask where you're going, they're also asking if you have hand sanitizers, if you're using it, and if you're sharing with the other passengers you have on board your vehicle. This is what is happening at the Tiptoe Lane, Osu, Akwaje, roundabout, and other parts of the capital. Indeed, almost all the vehicles have these hand sanitizers. Another reason I'm out here is to find out why people are out on the street. And like I said earlier, everybody has an excuse, going grocery shopping, going to the banks, going to the hospitals, and other places. But one lady was sent back home by the security personnel because she couldn't provide an ID card, an identification card on the from the pharmaceutical company where she worked. And so she was sent back home. She told me that yesterday she was able to go, but today because the security personnel are around and asking so many questions, she has to go back home and call her boss, tell her what is happening and the reason why she won't be able to be at work.
It's interesting that we're seeing traffic in some parts of the capital in sharp contrast to what happened yesterday. But tell us, have there been any arrests made by the police so far?
Alex, can you repeat that? I can barely hear you.
I'm saying the police at various checkpoints, have they made any arrests so far where you have been?
Yes, they arrested a few of the motorists. Some of them, they found out they didn't have any ID. They were just in town. So they had to take them to the headquarters and question them why they're out here.
Only motorists?
Yes, Ernest.
All right, Ifwa, thank you very much for that information. 7 nurses, 1 physician assistant, a pharmacist and a record staff at the St. Joseph Hospital in Koforidua have been quarantined and are closely being monitored by health personnel after they attended to a suspected COVID-19 patient at the hospital. Hospital authorities are expecting the test results from the Noguchi Memorial Institute to enable them take the next action. Maxwell Kudeko is our Eastern Region correspondent and he joins me live via Skype. Maxwell, when did those quarantine come into contact with this patient?
Well, the suspect in question is a rotation nurse at the St. Joseph Hospital. We are told that she
We seem to be having challenges with the line there, but we'll reconnect with Maxwell Kudeko to bring us up to speed on the situation at the St. Joseph Hospital in Koforidua, where we understand that some health officials are themselves being quarantined after they came into contact with a suspected case. And from what Maxwell is telling us, this suspected case is actually a nurse who is on rotation, and that means that is a staff, a colleague of theirs, who is now being who is suspected to have the disease, and of course they're expecting the results from the Noguchi Memorial Institute. Maxwell joins us on the line again. Maxwell, if you can hear me, you were telling us that this suspected case is a rotational nurse.
Yeah, exactly. We are told that she's a rotational nurse at the St. Joseph Hospital, but she received a parcel from China 2 weeks ago, according to our source. And then somewhere last weekend, she started feeling symptoms of the COVID-19. So she reported to the St. Joseph Hospital where she worked, and then she was attended to. When they interrogated her, they realized that she falls within the case definition. So a blood sample was taken from her, and then it was sent to the Noguchi Memorial Institute for tests. Hospital authorities are still waiting for the results, and we are hoping that the results will be in today. But because of the exigency of the situation, the authorities have cordoned off the OPD where the lady was attended to, and then 7 nurses, 1 pharmacist, a record staff, and then the lady's fiancé has been quarantined at the OPD, awaiting the results, and then the authority will take the next line of action. As we speak now, nobody have access to the OPD where the staff who attended to the lady have been quarantined. But we are told from inside source that the suspect is doing very well. They've attended to her, and then they are very sure and convinced that the test the results will be negative. The other health officials who were also quarantined since last Sunday are also doing very well. This morning, when I visited the hospital, I saw a couple of them walking around the OPD, even though they are not supposed to move outside the OPD. They were freely talking to each other, and then also smiling to each other. So, basically, this is the situation at the St. Joseph Hospital. Hospital director, Dr. Kupalo, told me in a conversation that they are still waiting to receive the report from Noguchi Memorial Institute, and then also take the next step. But not too long ago, the Eastern Regional Minister and the Emergency Public Health Response Team in the Eastern Region issued a release on the update, up to the minute report on the situation in the Eastern Region. And according to the report that they released, the Eastern Region have recorded a total of 28 clinical suspected cases of COVID-19. Out of the 28 suspected cases, they've sent samples to Noguchi for tests. And then the 27 out of the 28 results are in. All the 27 results prove negative. And the one is pending. The pending case, or the pending suspected case, is the one at the St. Joseph Hospital, which they are hoping to receive by close of day. In fact, they were expecting the result last time, but it is not ready. So authorities are still patiently waiting for the result. There's something they call regional contact tracing. So the regional contact tracing are people who traveled outside the country and reported in the last 2 weeks, but have contact with people in Ghana. So 4 of such people are reportedly in the Eastern Region. They have been able to trace 4 of them, and then they've taken samples of 3 out of the 4, and the samples have also proven negative. Now they have something they call returnees record. You realize that after the president's directive, or as it were, broadcast to the nation on Friday, a lot of people traveled from Accra. There was something we called panic movement from Accra to Koforidua, from Kumasi to Koforidua, and its environs. So the authorities in the region, the Emergency Health Committee, have been able to trace, together with the security agencies, about 33 returnees in the region who trooped or as it were arrived to the region after the president's broadcast. So 33 of them have been identified. They've taken sample of 2 of such people who entered into the region after the president's broadcast.
Maxwell, let's wrap up on this quickly. I know that. Let's go back to the issue of the health workers. The issue of PPEs has been an issue for some of the hospitals outside Accra. With this case at the St. Joseph Hospital, can you tell us how protected the health officials there are?
Well, this morning, before 7 a.m., I was at the facility. Almost every worker I spotted had a nose mask. But the major concern I gathered from a few of the health workers I spoke with off record indicate that they don't actually have the PPE, like this full protective clothing. Most of them don't have it. So that has been a struggle. Right. I'm told that they are still working to get in touch, or they are still working with the Ghana Health Service at the regional administration
to make sure that it is provided to them. And of course, Maxwell will be following up on this to make sure that the health workers actually have the PPEs that government has promised. You're watching Newsdesk with me, Ernest Menu. Still to come, aspects of President Akufo-Addo's latest address to the nation goes global as many fall in love with what has become the famous quote in the fight against coronavirus. We're taking a break. We'll be back with details. Stay with us. Thanks for staying with us here on Newsdesk. Now, some 15 samples from persons suspected to have been infected with COVID-19 in the Volta and Addo regions have tested negative at the Noguchi Memorial Institute for Medical Research. The Deputy Volta Regional Director of the Ghana Health Service in charge of public health, Dr. Senu Jokoto, who disclosed this, indicated surveillance has been intensified to ensure timely detecting of an infection to contain the spread of the virus. He made the disclosure when he received some hand hygiene materials worth 16,000 Ghana cedis presented by the whole Central Member of Parliament, Benjamin Addo.
The items donated included 25 sets of Veronica buckets, 1,000 pieces of liquid soap, and 1,100 pieces of hand sanitizers. The items would be distributed to health facilities, market centers, lorry stations, security agencies, among other relevant institutions. The Who Central MP, Benjamin Addo, indicated the donation forms part of his contribution towards the fight against the spread of the virus in Ghana.
These donations will be sustained. So this is the first tranche. From next week, we will come with more as and when we acquire, we are able to obtain more for distribution. I have also allocated 5,000 Ghana cedis to the municipal directorate. You take the money quickly, go and buy the personal protective equipment and distribute across all of these facilities so that they will be able to get assurance that when they have patients having symptoms, they will not be afraid to treat them, to approach them and give them attention.
Mr. Addo, however, expressed worry on the violations of the President's border closure directive.
We've got information that Okada riders are smuggling these people in. If you have any information to that effect, quickly alert the health authorities and the security agencies so that they can be picked up for isolation and testing before they enter town to start spreading the virus if they are importing it into our. You know, our borders here are pretty porous, and many people, for monetary reasons, will like to violate the rules which are embedded in the directives given by the President.
The acting Deputy Volta Regional Director of the Ghana Health Services in charge of public health, Dr. Senu Jokoto, lauded the initiative. He said stringent measures have been put in place to contain and prevent the spread of the virus in the region.
These items that we have today donated to the people of whole municipality will go a long way to help them fight this COVID-19 pandemic. Since the beginning of our heightened surveillance, we sent over 15 samples to Noguchi. and so far they've all been negative. We continue to suspect because that is the only basis or only evidence we have to show all of you that we are alert, we are working, and we are picking any case so that in the event, God forbid though, that we have any positive case, we will detect it early, we will contain it, and we'll manage. And by doing that, we are very sure that this condition is not going to spread across the Volta region.
Nonetheless, stakeholders are tirelessly working to set up a coronavirus testing center at the Ho Chi Minh Hospital. Fred Kwame Asari, Joy News, Ho.
Now, the Ghana Maritime Authority has donated some personal protective equipment, PPEs, to 3 healthcare facilities in the Upper East region to aid health workers there in the fight against the spread of the coronavirus. Though the Upper East region is yet to record a case of COVID-19, the Director General of the authority, Thomas Kofi Alonsi, who presented the item, says it is important that the healthcare staff are well equipped so they do not risk their own lives or health while examining potential cases. Correspondent Albert Sori has more.
The items donated by the Ghana Maritime Authority include gallons of hand sanitizers, pieces of nose masks, boxes of examination gloves and disposable gowns, Veronica buckets, and non-contact thermometers. They were donated to the Busa North Health Directorate at Sandema, the St. Lucas Hospital at Wiaga, also in the Busa North District, as well as the Upper East Regional Hospital at Bolgatanga. Presenting the items, the Director General of the Ghana Maritime Authority, Thomas Kofi Alonsi, said, "Government has not taken for granted the sacrifices that healthcare staff across the country are making as the country takes measures to control the spread of the coronavirus."
And to the frontliners, who are the medical officers who will be using this, we know that you have a yeoman's role to play as far as the fight against this pandemic is concerned. It is a difficult task, but we believe that with these resources that we are providing today, limited as they are, we are sure that they should be able to assist you, first of all, in protecting yourself so that you feel confident enough to embark upon the education that is required. And again, in the event that this pandemic enters the district, it is our firm belief that with these limited resources that we are giving you today, you'll be in a position to be able to stem the tide. Having said that, we also want to urge you to ensure that the little that we have brought are distributed to the sub-district so that they also put themselves.
Receiving the items on behalf of the Busa North Health Directorate, the acting district public health nurse, Pognap Comfort Amwak, said healthcare workers in the district were in need of more support to ensure their safety in the fight against COVID-19.
We are pleading that the frontliners, we need more support from other people and other organizations to come to our aid. People are suffering in the interland, and without those things, we cannot do our work very well. So we are pleading. Even people who are more advanced, you see how the disease is dealing with them. So you can imagine we those here. So we are pleading that more should come to support the district and the frontliners so that we will help combat COVID-19 in our district and the region as a whole.
Her plea was emphasized by the Upper East Regional Director of Health Services, Dr. Winfred Ofosu, after he received the donation on behalf of the Bolgatanga Hospital.
We have not yet confirmed a case in Upper East region, but we cannot say that we don't have anybody with a virus in the region. We continue to investigate cases that come to our attention. But one of the topmost priority at this time is protection of the health staff, particularly the frontline staff. If they are not protected and they get the infection and they die, it means that the rest of us are also in danger. That is the angle in which we see this donation as very, very, very crucial.
For Joy News, Albert Sorry, reporting from Bolgatanga.
Not everyone is too excited about how President Akufo-Addo is leading the fight against the global pandemic COVID-19, but there are, however, others who have nonetheless fallen in love with aspects of his speech on updating the citizenry on what they must know and what to do to win the fight against the disease. In his latest address to the country last Friday, the president, while outlining the latest measures, including movement restrictions, gave the following admonition.
I assure you that we know what to do to bring back our economy back to life. What we do not know is how to bring people back to life. We will therefore protect people's lives, then their livelihoods. For the next 2 weeks, I urge all of you, especially residents in the affected areas of Greater Accra and Greater Kumasi, to be reminded every day that the front line of the fight against coronavirus is your front door.